Hey everyone, I have some really exciting information today that I want to share with you about how we can promote the health of our whole families and especially the next generation of children who unfortunately are being born into this world sicker than ever before. We have developed a program which we were calling Calm Kids, but we are actually starting an even bigger program, HOMEGROWN RN. And this is acknowledging Suzanne Balestino, who is our resident pediatric nurse and such a powerhouse of blending a Western and holistic approach. She's very science-minded, very knowledgeable about health and medicine, but she also knows all of the holistic interventions that we use at Whole Body Healing. She's been trained in all the dietary protocols, all the detoxification protocols, and she knows how to blend the two and really make sure that we are giving our kids the best chance they have. So I want to talk a bit about how you might know your kid needs this kind of intervention and how we can get started. I really encourage you to visit just homegrownrn.com. I'm going to put the link in the description here, and you can see Suzanne is doing house calls as well as Zoom consults, and I'm so excited that we're just building out this program to be even bigger and better than before. And she is just a wonderful resource to work with her own story. So, some common signs that your child might have some underlying health concerns. A lot of times kids with underlying health concerns have a lot of nightmares and a lot of trouble sleeping. So maybe they didn't sleep much as a baby, or maybe they're just up scared a lot in the night, or they seem very wired and buzzy at night when they should be getting to sleep. There's definitely dysregulation in the sleep-wake cycle and in the hormones there. Similarly, they may have tantrums that are totally inconsolable. So they may be up in the middle of the night saying they're terrified, they've had these horrible nightmares, and then during the day they may have these huge meltdowns over small things. And this is not to say that every child who's ever had a sleeping issue or ever had a tantrum has an underlying problem going on. Of course, every child has little phases they go through, or maybe they have some trouble sleeping, or they have some nightmares, or they have some tantrums, but what we're talking about is a chronically repeated issue that's going on for more than 6 months. A lot of times when children have tantrums that are totally inconsolable over very small things, it's because their body is actually in a lot of pain and dysregulation, and it's the only way they know how to express their discomfort. A lot of children with these issues have a hard time socializing. Maybe they're having a hard time with eye contact, or they don't really seem to fit in very well with other kids. They're having trouble connecting with other kids. They're maybe extremely painfully shy, or they get picked on a lot, right? Like they're seen as kind of different by the other kids, or maybe they're the aggressors. Maybe they're the bullies. They have trouble expressing themselves without hitting or kicking or punching, etc. And again, a lot of times these underlying imbalances will affect what is called the development of our social engagement system, which allows us to build relationships with other people in a healthy way. There's often a lot of struggles in school, right? Daydreaming, fidgeting, not being able to focus, hyperactivity, causing chaos in the classroom. And again, I think our modern school system, they expect a lot of stillness out of our kids that may not be natural, so some amount of difficulty in school might be normal or within the realm of normal, but really extreme issues with focusing or concentration. Kids might be complaining of stomach pains a lot. They might be saying, my stomach hurts, or they might be crying that they're in pain, they hurt a lot. You might feel that their belly is a bit bloated, as well as skin issues. They may get rashes or hives very easily or very commonly, have a lot of seasonal allergies, or develop more and more food intolerances. They might get sick a lot, right? Every year they're in the hospital for pneumonia, or they've got to go to the doctor all the time for strep, ear infections, sinus infections. Feels like they're always being given antibiotics. Again, one, or two illnesses like this might be more normal, but really children should be able to get through with maybe one round of antibiotics or none. So if they're having yearly issues like this, it's a sign something's going on. And so you're going to the doctor, right? And they're saying, no, this is normal. Kids just have these issues. Or, oh, if you're having this kind of problem, here's a medication I can prescribe. They generally are pretty dismissive. They're not really wanting to explore what might be causing the issues. And then at school, certainly there are counselors and mental health therapists and other people who might be able to give you some parenting strategies, who might be able to give teachers some techniques for managing your child's time in the classroom. There's a lot of these helpful interventions. Maybe an IEP needs to be developed, to help accommodate your child's needs in the classrooms. But again, no one's asking the question of why is the child having so much trouble in the classroom? What is making this child so fidgety or disruptive or hyperactive or, daydreamy? Diet and home life, routines, etc., are almost never addressed. And these are actually some of the most important factors in your child's health. So a lot of this comes down to the foundations. This comes down to nutrition, this comes to toxicity, this comes to microbiome health, this comes to daily routine. And these are the major factors that affect the development of our health over time. And the earlier we start on these interventions, the better, because kids can recover really fast. If we catch these signs early, we can intervene very quickly and we're going to see very big changes. If we don't catch them early, then what's going to happen is your child is going to start to develop severe allergic disorders, mast cell activation syndrome, eczema, psoriasis, autoimmune conditions like Hashimoto's or lupus, severe digestive disorders like colitis or Crohn's or celiac. They're going to potentially develop more neurological conditions, right? Dysautonomia and POTS is happening earlier and earlier. Maybe even psychiatric conditions. Maybe they're going to develop severe eating disorders or bipolar or major depression or even psychosis at a young age. All of these small factors we're talking about. Oh, my kid's just getting some skin rashes sometimes. Oh, they just have a hard time concentrating in school. Oh, they're just complaining of stomach aches all the time. Oh, they just have these outbursts sometimes. All of these are the seeds, right? These are just the beginnings of the illness. And if they are not addressed, they very likely will develop into these much more serious things later on. So I know me and a lot of the adult clients I work with wish that someone had intervened sooner. As much as we might have kicked and screamed and hated it as a kid, it would have been such a gift to have had that early intervention where things can turn around very, very quickly. We can stop those seeds from growing. We can really pull them out from their root. So this is a really critical moment of intervention, and it's especially important to Suzanne as well. Suzanne Balestino, who is our pediatric nurse, who is the HOMEGROWN RN. I mentioned before, really encourage you guys, homegrownrn.com. She's doing home visits, she's doing Zoom consults, she's doing some incredible work. But her daughter had all of these signs early on. She was a picky eater. She complained about being in pain a lot. She would have these, emotional outbursts. All of these things she saw. But, she was just told by doctors and other people like, oh, she's just a sensitive kid. She's fine. She'll grow out of it. She did not grow out of it. By the time she was 12, she was starting to get some really debilitating symptoms. And she actually got to the point where she had full body neuropathy and paralysis. And they went to specialist after specialist, doctor after doctor. No one asked them about the foundations. No one asked them about the nutrition, the toxicity, the daily routines, anything like that. They did give some, here's a diagnosis, here's a medication to try, et cetera, but nothing actually comprehensive, no deeper explanation. Luckily, Suzanne and I met and we got her daughter on the right track, and by implementing those foundations, she made a full recovery and she's now in college, living a full and thriving life. Again, if we can get in early, even as a teenager, kids can make a huge turnaround. But it really showed Suzanne that there's another way to approach these issues. So, Some people will get very caught up on, I've got to go see all these specialists, I've got to go to the doctor, I've got to make sure I know exactly what's going on with my kid. And we're certainly fine with you seeing the specialists and trying to get the diagnosis, but we want to make sure that you understand your reasons for that, because the main reasons to get those labels is basically for your school and work accommodations or for access to medications. If your child has a mast cell disorder and they need a mast cell stabilizing medication, absolutely pursue the diagnosis. If your child needs to have absences excused because their symptoms are so debilitating and they aren't able to come to school as often as they would like you to, you might need a diagnosis on their file so that you can have those excused as medical absences. But those are really the reasons. A medical diagnosis does not actually tell you the root cause, and it does not tell you how to recover. To find out those things, we actually have to look at your symptoms, because the symptoms are the language of the body. And so if your child is having a stomach issue, we know there's a gut microbiome issue. If your child is having a skin issue, we know there's a gut microbiome issue. If your child is having a mental health or neurological symptom, we know there's a microbiome issue and probably a nutrient absorption issue as well, because we know the brain and nervous system are so energetically and nutritionally expensive to run. So you can see how we can look at the symptoms and say, okay, here's the symptoms, here's the root of what we have to adjust in order to see changes here. A diagnosis isn't going to do that. A diagnosis is going to be, oh, they have dysautonomia. Dysautonomia doesn't say, oh, we need this microbiome and nutritional intervention. It's just a label. So, all symptoms that last more than 6 months are a sign of deeper imbalance. It is your body speaking to you, telling you what you need to do to rebalance. And so, your children are counting on you. Your children are counting on you because they don't have this same relationship with their body yet. They don't know how to understand the symptoms that are going on. And so it's up to you as a parent to find the appropriate help to give your children an opportunity to recover right now, right away, before things get worse. How do we do that? So there's 5 main things. We have to rebalance the gut microbiome. We have to make sure the balance of bacteria in the gut is correct, that there's no major parasitic or candida overgrowth. So we have to check in with all of those things, and we have to adjust the diet as a primary intervention to rebalance the gut. Now we have multiple levels of intervention depending on where your family is at. So we have some really basic interventions. If these kinds of nutritional changes seem really, really daunting, we have just some really basic things that we can do to just put your family in the right direction. We also have kind of a mid-tier, which is if your family is ready to do a little more intensive interventions, but you don't want to do anything super restrictive for your kid, you're concerned about that. We have kind of some middle options. And then for kids who are really quite sick, and unfortunately, I'm talking about kids who, maybe they have some symptoms here and there, but there are kids who have very significant symptoms already, who are developing autoimmunity or diabetes by the age of 6 or 7. And so we have some very intensive interventions that we can do for kids who are really that sick, that young as well, which looks more like the GAPS diet, specific carbohydrate diet, etc. So this also helps us resolve the leaky gut. This helps us seal the lining of the gut so we're not getting that systemic inflammation that's coming from the gut into the rest of the body. And this can cause almost every chronic illness symptom, as you probably know, in children as well. And then we want to increase the nutrient density of the diet. So helping to heal the gut will increase the absorption of nutrients. But as I mentioned before, children need a lot of nutrients, not only to run their brain and nervous system, but to grow their brain and nervous system. Children have the most energetically intense demands because they're still growing the tissues of their body. And unfortunately, children have this very nutrient depleted diet very often because we've catered to this idea that children want bland food. And we're basically, breeding these generations of children that are relying on these very nutrient depleted bland foods. And we're saying it's okay because they're just kids. But it's not okay. It really should be the opposite. And so If your child's a very picky eater, we understand. We're here to work with you and figure it out. We have a lot of creative ways to adjust your child's diet and increase the nutrient density through strategies that they will be open to. And so that's why Suzanne is here to work directly with your family to help figure this out. And then we also want to provide non-toxic alternatives to common products. Children today are often born already with thousands of toxic chemicals in their body, as well as heavy metals. And we really need to address this. There really is not a child born today on Earth, unfortunately, that has not had some amount of this toxic exposure. It is just pervasive in our environment, and it's getting worse and worse, unfortunately, with every year of industrialization. And so we need to mitigate that where we can. We need to make sure that we are product swapping as much as possible. So Suzanne is able to go through a whole product audit with you and meet your family where they're at, with your budget and your ability to just kind of slowly prioritize and go through how to make your home a non-toxic refuge. And if you've already done all those basics, Suzanne's ready to teach you some really simple detoxification strategies that are safe to use with children. Obviously, we don't want to do any super intense detox protocols with children. That's really not safe, but we do want to bring in some supports that are going to be well tolerated and can slowly help mitigate this toxic load that so many of our children are born with today. And we also want to provide support and structure for your family when you're dealing with a kid who has a severe chronic illness or even just disruptive symptoms. First of all, it might indicate that you probably, as a parent, have health issues yourself, because we tend to pass these conditions down in our family. And so you might be dealing with your own chronic illness issues. And it's even more exhausting to now be worried about your child's health. And so we're here to help you triage and prioritize and vent and get the emotional support that you need. This is really important. And also to implement clear routines and structures in your family that is going to make life so much more streamlined and simple for you, and to really develop good parenting strategies for how you explain these things to your children, the kinds of boundaries and parameters you set with what's acceptable in your home, what are kind of your house rules, your kitchen rules, when to be a little more lax about that as you're traveling or going to friends' houses or when they're at school, and when to be really strict about it, and how to basically collaboratively problem solve with your kids, with your partner, about what is going to be the best path forward to optimize everyone's health that still feels reasonable, approachable, and accessible. So we work through all of that with you. So let's see. I think the main thing I really want to emphasize as we wrap up here is that these kinds of health problems that kids are dealing with, whether they're already very serious or you're just seeing some mild signs, they can be addressed, and they can be addressed today. And the answers can be simple, and they can be natural. You don't have to find some complicated protocol. You can just implement simple interventions in a paced manner that works for your family, and you're going to see amazing changes happen over the weeks, months, and even years. The reality is your kids deserve to be set up for success. They don't deserve to have their problems ignored because it feels too overwhelming to address them. They're just going to get worse later. These symptoms do get more serious over time if we don't take them seriously. So, Homegrown RN, Suzanne Balestino. She is just an incredible person. She has the biggest heart. She's can give you all the structure and support that you need, and is also so kind and so willing to meet you where you're at. So I really hope you check out her new website, HOMEGROWNRN.com. She's located in Massachusetts, but she will travel and she will do online consults as well. So please check her out, and thanks for listening.